This is Dr. Kamel again, and a new content related to the physical therapy license preparation. If you have not seen any of my videos before, I would like to introduce myself briefly to you. My name is Dr. Kamel, and I work as an associate professor of physical therapy in the United States and an registered licensed physical therapist in the United States as well. And in the UK and Egypt, I have got my PhD from University of Nottingham back in 2011. So let's go and see the content for today. The question saying a physical therapist is working with a 76-year-old patient, quite old, who has mild dementia and is beginning a home exercise program to improve balance and mobility. So we have two things here. The patient have a problem with balance and mobility, some physical problem, but at the same time, the patient have mild dementia, which will affect our physical therapy training or intervention for sure. During the teaching session, the patient becomes confused when multiple steps are presented together and often forgets instructions that are explained too quickly. I told you the patient is old and already have dementia, so remembering all these, giving the patient several steps at the same time and and asking the patient to retain them and apply might be difficult. The therapist wants to choose the most appropriate teaching strategy to help this patient retain and follow instructions effectively. Which of the following strategies should the therapist use? Number one, use auditory or visual input separately. So either giving the patient auditory input or visual input separately, not at the same time. Use metaphors to reinforce new concepts. Establish a consistent base of teaching. Yes, it is important, but it might not be the most important thing, as we will see now. Present one piece of new information at a time. Yeah, this might be maybe the last option might be the most you know, good option of all these options, or the realistic one because the patient has a problem in retaining information. Okay, so present one piece of new information at a time. This is a correct answer. A patient who have mild dementia, they have reduced working memory. They have difficulty processing large amounts of information. So we need to present one piece of information for them at a time and then go to the next one. Slower cognitive processing. Therefore, breaking instructions or physical therapy instruction or motor learning for them into small, simple steps, one new piece at a time, help them first to understand, second to retain, and the third is successfully perform the task, which is our ultimate goal of this motor training and physical therapy intervention. So the most evidence-based supported teaching strategy of dementia is to present one piece of new information at a time. Let's now go to the incorrect options. Number one, use auditory or visual input separately. Yes, yeah, yes, it is, good strategy, but it is not the most effective one for dementia. Okay. So actually giving multi-sensory or multimodal teaching, like showing the patient what to do and tell the patient what to do at the same time, visual and auditory. This will help to reinforce learning. Okay. But as the patient already have dementia and the patient is old age, using only one modality separately, either auditory or visual, might not help comprehension too much. okay, retaining this information too much. Okay, so we need to reinforce both visual and auditory inputs at the same time, not separately. Use metaphors to reinforce new concepts. Metaphors actually require a skill called abstract thinking, which will be usually impaired in dementia. Okay, so as a patient is already confused, okay, when we introduce metaphors for the patient, this might increase the confusion actually. So it will not help. Actually, it will not, it will increase the confusion. So these patients need concrete, direct, and literal instructions. Okay. It is not about introducing new concepts and stuff like that. No, it will not help. Establish a consistent pace of teaching. Yes, this for sure. This is helpful, but this is not the most efficient one on its own. Yes, I will do step by step information and teaching. I would like to establish a consistent base of introducing this information one at a time, but this is not, the most efficient or strategy. Okay. Why? Because even if I am not using a consistent base, presenting too much information at once, the patient will be feeling overwhelmed. Okay, so so this is not the best option of the four options. So to summarize, number four, which is the correct answer, present one piece of information at a time. This is the best choice. Okay, and this will support memory and clarity for people who have dementia. Use auditory visual separately. Yes, we said it is important, but it would be more efficient if we use visual and auditory inputs at the same time, so multimodal or multisensory approach. Use metaphors. This is poor, and this will be difficult for people who have dementia. Consistent base, this is helpful, but it is not, not enough as a description in motor learning, or it is not the best efficient strategy for those patients. If you would like to have more information and join my BT license exam preparation course, please send me a WhatsApp message on this number 0014422487206 or 0020-102-774-3702, and I will send you all the information needed as much, as I can. And for graduates or physical therapy graduates who are interested in applying and joining the transitional DBT or the post-professional DBT at University of Montana at a discounted rate, I can help them with that. So please also send me a message on WhatsApp number, one of these numbers, and I will give you the information, required documents, and how to apply as soon as I can. Thank you for following and watching me. Please don't forget to subscribe to the channel so you can get every new video or every new information I am submitting. And see you soon in a new video.